Uh, Let me introduce my group. We are from group 4, and the members, Hairin Wanda Aurelia, Lia Hikmatul Maula, Luvita Kurniawati, and me, Meli Francisca Putri. Now, I want to show you about diabetes mellitus food exercise. And for the first presentation about me. Next. Definition. What is diabetes mellitus? Diabetes mellitus is a group of metabolic disease characterized by high blood sugar levels or glucose that result from defect in insulin secretion or action or both. Next. Etiology. What causes diabetes mellitus? Insufficient production of insulin, or either absolutely or relative to the body's needs, or the inability of cells to use insulin properly and efficiently, leads to hyperglycemia and diabetes. This is the primary problem in type 2 diabetes. The absolute lack of insulin, usually secondary to a destructive process affecting the insulin-producing beta cells in the pancreas, is the main disorder in type 1 diabetes. Next. Classification of diabetes mellitus. Diabetes mellitus type 1 or insulin-dependent diabetes mellitus or IDDM. In type 1 diabetes, the pancreas incapable of making insulin. Abnormal antibodies have been found in majority of patients with type 1 diabetes. The patient with type 1 diabetes must rely on insulin medication for survival. Next. Okay, next presentation by Luvita Kurniawati.
Classification of diabetes mellitus. Diabetes mellitus type 2 or non-insulin dependent diabetes mellitus or NADDM. In type 2 diabetes, patients can still produce insulin but do so relatively inadequately for their body's needs, particularly in the face of insulin resistance. A major feature of type 2 diabetes is a lack of sensitivity to insulin by the cells of the body, or particularly fat and muscle cells. Next. Signs and symptoms. What are the symptoms of diabetes mellitus? First, dehydration. Second, weight loss. Third, fatigue, nausea, and vomiting. Then infection of the bladder, skin, and vaginal areas, and lethargy and coma. Next. Treatment. How can we treatment the diabetic people? First, taking insulin. Second, anything anti-hyperglycemic drug. Third, exercising regularly. Fourth, maintaining a healthy weight. Then eating healthy foods and monitoring blood sugar. Next. Diabetes exercise or foot exercise. Leg gymnastics or foot exercise is an exercise in leg movements that can increase blood flow to the legs. Next, objectives and benefits. Exercise or sport can have an impact on controlling the condition of diabetes mellitus patient through one, increase the use of insulin by the body. Two, helps burn body fat and helps control weight. Three, increase muscle strength. Four, improve blood circulation and decrease nerve damage. Five, reduce stress, increase relaxation, reduce tension and anxiety. Next. Benefits of diabetic foot exercise. One, improve blood circulation. Two, strengthen small muscles. Three, prevent foot deformities. Four, increase calf and thigh muscle strength. Five, overcome the limitation of joint motion. Six, reduce pain, cramps, and stiffness. Next will be presented by Lia Hikmatul Mola.
Okay, things that need to be considered. One leg exercise can be carried out if the patient has blood sugar and controlled blood pressure. Two, foot gymnastics can only be carried out by diabetic patients who have no wounds on the legs. Three, the exercise can be carried out 3 times a day on morning, afternoon, and evening each for 10 until 20 minutes. 4. Exercise is carried out 2 hours after eating. Foot exercise steps. The steps for foot exercise are as follows. 1. Sit well on a chair while putting your feet on the floor. 2. While placing the heels on the floor, the toes of both feet straighten up and bend down by 10. Next, 3. While placing your heels on the floor, raise the soles of your feet to the on. When the toes are placed on the floor while the heel of the foot is lifted up, this step is repeated as many times as 10 times. 4. The heel of the foot is placed on the floor. The front of the leg is raised up and a 360 spin in made by moving on ankle 10 times. Next presented by Herin Wanda.
Okay, thank you, Leah. I will continue this presentation. 5. The tools are placed on the floor, heel raise, and 360 degrees rotation made with movement of the raised leg 10 times. Next. Based on this picture, 6. The legs are raised up by straightening the knees around 360 degrees made with ankle movement 10 times. Next. 7. Knees are straightened and bent down by 10 times. Repeat this step for other leg again. And last, based on this picture, place a piece of newspaper on the floor. Squeeze that paper. Place a piece of newspaper on the floor. Squeeze that paper into a white paper using both feet. This step is done only once. Next.
Yeah,
Melly.
yeah, Hairin, waiting enough. Thank you for your attention. See you and wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam
Waalaikumsalam
warahmatullahi
warahmatullahi
wabarakatuh.
wabarakatuh.